common neurologic issues include a spinal cord injury, a stroke, multiple sclerosis, Parkinson's disease, spina bifida, transverse myelitis. They actually can lead to a variety of different bladder and urinary sphincter problems related to bladder function. So patients with a neurogenic bladder can have a problem with storage. The bladder starts to fill and then just says, sorry, I'm not waiting, and goes without their permission. That can lead to urinary frequency, urgency, and sometimes leaking before you get to the bathroom. You can have poor compliance, which means the bladder doesn't stretch out normally. And that's a potential issue because it can cause damage to kidney function. We take this very, very seriously. When your bladder empties, you may not empty out completely. We may have to figure out a way to allow your bladder to empty better because you leave too much urine behind after you theoretically have emptied your bladder when you have a neurogenic bladder. And downstream, we can see problems. If our bladder is the reservoir, the sphincter is the dam, and that's always tight until it's time to empty. And when we empty our bladder, void, pee, that sphincter relaxes and we pee. But that sphincter might not work well, so you're leaking. Or that sphincter might work too well and almost blocks you when you try to pee. So there's a wide range of issues that we see with neurogenic bladder. So how do we treat neurogenic bladder? It really depends on what your problem is. We talked about a variety of options. There are medications. There are a variety of interventions, whether it's nerve stimulation, botulinum toxin injection. We may need to use catheters. We have surgical options, small, minimally invasive options, to ones that are bigger in terms of reconstructing the lower urinary tract. We're always going to try to go from less invasive to more invasive, and also keeping in mind what are the other issues. Everyone that has incontinence doesn't have a neurologic problem. We'll ask questions that may give us hints not only to why their bladder is misbehaving, but maybe there is something neurologic going on. And this doesn't happen infrequently, where I'll diagnose, not diagnose, but I'll have an inkling there's an undiagnosed neurologic problem. We're taking outstanding care of patients with neurogenic bladder. There are not a lot of places that really have a strong focus on taking care of the patient with a neurogenic bladder, neurogenic lower urinary tract dysfunction. Most of the neurologic conditions aren't being cured. They're chronic conditions. So from a neurologist or neurosurgeon point of view, they're doing what they can to minimize the problem. And the question is then, where you are with your neurosurgical or neurological treatment, where is that bladder? And then the question is, what part of this bladder dysfunction bothers you? And then how are we going to focus to make that better? So I'm not curing neurologic disease, but we're going to really work on absolutely minimizing the urinary symptoms related to that neurologic issue.